at all levels have been charged to release at least a proportion of 0.05% of its total annual budget to fast-track interruption and elimination of neglected tropical disease in Nigeria. This was disclosed in an interview by the NTD National Coordinator, Dr. Ntd. He said there is a need for both the government and private sector to collaborate in providing funding in the health sector in order to meet the demand of healthcare delivery, especially with the current growing population of the country. There is no doubt funding for health is on the concurrent list across the three tiers of government, but issues of channeling this fund to the appropriate direction to curbing NTD-related cases have been a major concern that calls for urgent attention by all stakeholders, particularly as about 583 LGAs are endemic to lymphatic filariasis, while others have about 2 or 3 of these neglected tropical disease. Prior to this, treatment and administration of NTD-related drugs to patients across the 774 LGAs has been relatively low due to lack of ownership on the part of the government and persons affected by these illnesses.
Population is increasing day by day, and we all know. Today we are over 200 million, and when we're less than 200 million, we make provision and it goes around. Now we are funding, but the funding is not enough. It's on the concurrent list, and we have a budget. Now, when we talk about the sporadic population that we have, it doesn't mean it's only federal government that should take up the funding. The funding should water down to the states. It should also go down to LGA. Most of the states have funding for health, but sometimes we don't channel it properly. We really want corporate organizations, private sector participation in health sector, healthcare delivery in the country. That would go a long way in supporting government, because day by day we keep on having a spike in our population.
Also speaking, the UNICEF World Specialist Bioye Ogunjobi noted that NTD drugs and treatments are provided freely to countries like Nigeria that are endemic to the disease, thus urging the government to shoulder the responsibility to ensure the mass administration of these medicines for proper elimination.
Much more important now for the government to shoulder the responsibilities of providing overarching coordination of all the interventions in Nigeria. And that will mean probably the federal government now funding evaluation, and whether it is entomological or epidemiological, whether it is assessment, and then we'll also be happy if the government begins to fund mass administration of medicine. The medicines are donated free of charge by the US government, and UNICEF is providing certificate to ensure that we don't pay. Also, definitely we want the government to shoulder the responsibility of making sure that people use the drugs.
Meanwhile, on the issue of lack of ownership to the NTD programs and treatments, the World Health Organization resource person, Dr. Aliyu Suleiman, said eliminating these diseases require concrete action and commitment from both states and communities so as to avoid unnecessary demand from donors to boost the sustainability of NTD control and eradication. Adding that, considering some of the hard-to-reach parts of the country, the only way to motivate development partners is when all actors take it as their responsibility to ensuring that those affected are treated to effectively reduce the rate of morbidity and mortality in the country.
Community members, their leaders, and every other person could own it, understand it, and begin to take action. Action means that once support is being given, you don't need to unnecessarily demand for additional support in terms of maybe finance or something else that is increasing the cost for the partner or for whoever is coming in. For islands, a number of hard-to-reach communities and the rest of them. So taking drugs, taking medicines, taking health intervention to these places can be difficult. It could be daunting on any partner or anybody bringing this free medicine to now receive an additional request for maybe money or for logistics to take it to the next level. If there is ownership, then you should be able to hand it over to the people in that place, recognizing that they have this problem. Then they should be able to begin to make the intervention themselves. There's a lot of benefits regarding ownership. It means that there will be sustainability. That's the key factor regarding ownership. So if you are not there, the people will be asking you. So there will be demand for health commodity. because they know that they have a problem. So they will be asking the government, they will be asking the partners, they'll be asking people to come in to help them. And when these people come in to help them, then the health costs can actually be, reduced. However, if they are not the ones demanding, and you come in there to provide the support, and they really don't know that they even have this problem, then we'll start having problems of ownership. Okay, so it's a collaborative thing where the partner, whoever is coming in, should let the people know that this is happening, these are the issues, this is the action to be taken, and this is the impact.
It was gathered that those who volunteered or were selected for the distribution of these free NTD medicines are demanding for honorarium from donors. Hence the need for stakeholders and government to step up its funding capacity so as to sustain the program in Nigeria. Vincent Okushi, Quality Television.